Our profession of neurology has been challenged in ways that we could never have imagined a few years ago. We're under siege by all quarters, including regulatory agencies, insurance companies, and patient groups. To be able to be successful, we need to be aligned as much as possible with all our colleagues. This includes adult neurology and child neurology. To that end, we have approached the Child Neurology Society about putting together a work group that we feel helps that alignment. We have not always been as aligned as we should be, but we are now. Ralph?
This is just the beginning, and I'm so happy that, Terry, you have started this, and I plan to continue all the great work of this Child Neurology work group and really begin to implement some of the changes to bring the groups together. I think it's so crucial if we're going to make our voices heard that we work together as larger teams across the lifespan, child neurologists, adult neurologists, as well as our subspecialty partners. And there's a whole big focus today on across the lifespan for the way we treat many of the patients we deal with. Child neurologists need to be right at our side with adult neurologists. So I'm looking forward to carrying forward.
And Anne, you are both a leader of the Academy and a child neurologist. So we'd like your comments.
Okay. Well, I've been part of this and watched it from the beginning to implementation. And then really where it came to life was at the last meeting. So it's been real. It's been not just talking about it, but bringing it forward. And in the last meeting, with a tremendous amount of support, we had 5 scholarships of up-and-coming young child neurologists who were able to come to the Academy meeting. They came, and there was actually a panel at lunch in which other child neurologists talked about their road to becoming active. And then there were courses and different things in the afternoon. It was incredibly well received. And the fun thing was that there were some child neurologists, certainly, but there were also some adult neurologists who said, please, we take care of the whole lifespan. And one of the main topics was transition, which I think is critical because what we do and have successfully done now have become adults, and suddenly they are the whole spectrum coming to adults, and hopefully we will be able to be part of all that longitudinal.
And some of our child and adult leadership programs that have started under you, Dr. Casino, we have some great child neurologists that have been part of our ELF programs, our diversity leadership programs, and our other women in leadership programs, thanks to you.
So we have really tried to fully integrate our colleagues in child neurology with adult neurology. I think sometimes in the past that we gave the perception in adult neurology that child neurology was a subspecialty of neurology, kind of like epilepsy or movement disorder. But that is not the case. Child neurologists and adult neurologists are neurologists with a variety of subspecialties. And so I think we come with that new attitude, which I think is very important. The other thing is we've sought out the advice of leaders of child neurology, not just Dr. Tilton, but a variety of leaders, including most of the past presidents, immediate past presidents of the Child Neurology Society, and the current president, Dr. Ken Mack, who is my colleague. Those have been very productive talks, and we will continue those both informally and formally.
I'd like to say a little bit more about the scholarships that came out of the Frontiers in Child Neurology. The scholarships allowed 5 residents to come to the meeting, full scholarships, the travel, and the registration. And with that, the obligation was, of course, that they became part of our meeting. And they really enjoyed it. They were able to stay through the whole setting. And the thing that we're really hoping will happen is that they will stay integrated into the system, into the Academy of Neurology. And not only that, to take it forward to the Child Neurology Society as well, where we're going to have other leaders who are child neurologists meet and maybe carry that forward as well. The other nice thing about this is that these people can be identified as young and up-and-coming leaders and scientists and others that we can involve in committees, involve in work groups, and that way we can allow more and more child neurology representation throughout.
To be successful, I really believe we've got to be together. The things that we're looking at, things like demonstrating the value of neurology, which will require a large registry, things like neurology burnout, can only be done if most of the colleagues in the profession participate. And that certainly has to include a big section of our colleagues who are child neurologists. So to that end, we're working very hard on making sure that happens, and we look forward to working with child neurology for the future.
Good.
That's
Thank
right.
you.
Thank you.